Welcome to the Smile Sisters podcast, powered by the LA Dental Clinic. In each episode of the Smile Sisters, host Dr. Ozzy and Dr. Arazu Nasiri show you how you can transform and maintain your smile. The sisters explain everything you need to know about your mouth and why keeping it healthy is key to your overall health.
Okay, welcome back to another episode of Smile Sisters. So today we're going to talk about color.
Color, yes. How white should you go?
How white should you go?
We're not talking about anything other than your teeth here.
That's right.
But so I had a patient who was very fair, and we were choosing color for her veneers just recently. And she made the comment that she's very fair, so she can pull off really white teeth.
Right.
Right? And I was thinking about that, and I didn't say to her, but I'm thinking about it. And it really doesn't matter what the color of your skin is, because anybody can have really white teeth and it looks good or bad depending on other factors, but not on the color of your skin.
First of all, what is the thing that causes one tooth to be whiter than the other?
Whiter?
Yeah, like it's the enamel, right?
Right. So natural teeth, non-veneered or no, bonding on them or whatever.
Right.
Are generally, there's a couple of reasons why. Some of it is genetic, and it has to do with the inherent inside color of your teeth.
Right.
And that is a factor. The other is how much enamel is on the surface of your tooth. So our teeth are made up of like an inside layer that's more yellow, and some people's inside layer is yellower than others.
Right, and it shows through more.
Yes.
And some people's inside layer is whiter. And then also they have like a thicker outer layer, which also covers it.
So the enamel is a thicker outer layer, and it's usually quite white.
Yes.
Right? And so that layer, depending on its thickness, like you said, can block out more of that inside yellowness of your teeth. So some of the factors that do actually affect the whiteness of your teeth is, one of them is, we don't want to be racist and say it's just your skin. For sure it's not. But we can be a little ageist and say, as you get older, your teeth do get more yellow. And the reason for that is that you wear off more of the enamel of your teeth just from wear and tear on your teeth.
Yeah, so that inner yellower layer shows more.
Usually as you get older.
And also you expose your teeth to more coffee, more smoking, more red wine. And so both from getting thinner and also from getting stained.
Yes.
So from both sides, it's getting kind of yellower.
And sometimes you can get cracks in the enamel of your teeth that are not a bad thing necessarily in the sense that it's going to weaken your tooth, but it can like stain. So some people have these lines on their teeth, and that's just because there's like little cracks in the enamel that picks up more stain.
Little stains, yeah. So I guess the question is, how white should you go?
Right, yeah, totally. And so really this has to be based on what it is that you're after, right? So if you want it to look natural, if you want your teeth to look natural, if you want to look like you have a nice smile but not nice veneers,
right?
Okay, then you have to
if you want people to say nice smile versus good veneers.
Yes, that makes a difference for sure.
Yes.
But some people really do want that. They want others to know that they got veneers on their teeth. No judgment here. That is not my preference. But if you want that, then you can go whiter. But the other factor here is the opacity. So you can have white that is like really, really solid white, like a refrigerator door, and it's really flat looking. And that will always look fake, no matter what color you make it. Does that make sense? It could be white or yellow, but it's really flat.
Well, okay, let's first of all say what opacity is. Opacity is how kind of see-through it is.
Totally.
How much you can see through, and that matters because our natural teeth are a little bit see-through. So when light hits our natural teeth, some of the light actually can travel through the whole tooth.
Yes.
And some of it gets bounced back. Whereas if you have a surface like a refrigerator that is not see-through at all of the light gets bounced back. So it looks a lot more stark white.
Yes.
Whereas something that has less opacity doesn't let all of the light bounce back. Some of the light travels through, so you don't perceive it as being so white.
So the way this is done when you're doing, for example, porcelain veneers is that or with composite bonding, is that you do a layered technique. So you actually copy the different opacities or the different see-throughnesses of the natural tooth in your restoration that you're doing. So for example, when we do composite bonding in the office, we layer it. We put a translucent layer at the base, then we put a more opaque layer, then we put another layer on top that filters the light out somewhat.
Right.
And these layers are meant to sort of mimic the natural tooth structure.
And you can do the same with porcelain veneers.
Yes. So a skilled lab technician who does this, and these guys are artists as well, will do the same thing. They'll build your whole tooth up in porcelain. Then they'll shave off some of the sort of biting edge of it and add translucent layers and staining on the inside, and then put another layer of porcelain on top.
Right.
And this also mimics that translucency, the filtered layer that sort of bounces the light back, and then another layer on top of that.
Right.
So really, when you're thinking about doing cosmetic work, you want to find a dentist that understands these concepts.
Well, if you want that look,
If
so
want
you
that
got to
look,
know that
Yeah, yeah.
maybe you do want the really white look. And some people do come here asking for that.
Now, some people ask for white, but they still want it to be natural. And what I want to stress is that you can do both.
Right.
So you can have white that's very sort of flat and opaque because light doesn't reflect through it, and it's kind of consistently the same color from your gum line to the biting edge. Or you can have the same whiteness, but have that translucency and have a little bit of that staining that kind of makes it look more natural.
What do you think of Gavin Newsom's veneers?
I don't know. I haven't honestly looked at them to know.
They're so white.
Are they? So
I hope he has veneers because otherwise his teeth are amazingly white.
So, you know, when you're thinking about this, actually, that's a good point. Because often when people come for consultations, I'll tell them to bring photos of what they like, because that gives me a really good idea of what's in their head. But really, your skin color has nothing to do with the color of your teeth that's going to look natural and good in your face. You can't pull it off more or less because of that.
Right.
But there are other things that affect it. So we talked about age a little bit.
Yes.
And doing age-appropriate colors. But I do have patients that are older who are like, no, I've always wanted a bright white smile.
Yeah.
I want to get it. And I'm not going to judge, and I'm going to do it for them. But, you know, you really want it to fit into who that person is. You know, if you have a bunch of gray hairs and wrinkles and you have really bright, white, straight, perfect teeth, often that's just not, you know, what you might see out there in the world. So you might understand that it's not real.
Right.
But the other thing that affects it is your facial structure, right? So if you're like a square-jawed guy who like lifts weights, then we kind of want to give you more square, kind of sharp-edged corners of your teeth.
Right.
Because often those people grind their teeth as well and clench, right? Imagine someone who's lifting weights, they're clenching.
Yeah, you got to clench.
And they wear away kind of the soft corners of their teeth. Whereas if you have somebody that's really like a young girl, like a smaller young girl, you know, very like fine features, more of a rounded face,
Right.
then like a square-edged, sharp-cornered teeth are just not going to look right in her face.
Too aggressive.
Too aggressive, not going to look right in her face. So
Yeah.
that's one factor. Then the other is the amount of translucency. When you're younger, you have more tooth. You haven't worn it down yet.
It's
So
longer.
It's longer. And
Right.
the edges of your teeth, the biting edges, have more of that translucency to them. As you grind your teeth down, you wear your teeth on, they get a little bit more opaque.
Well, okay, yeah, because the translucency is not the same for the whole tooth, right? So the biting edges, the tips of your teeth are actually more see-through than the part that's closest to the gums. So as you age and you wear down the tips of your teeth become less translucent.
Yes.
Because now you're wearing down the most translucent part. So now you're seeing the more opaque parts. And that's something to think about too when you're deciding on the color and the opacity and the whiteness.
Yeah. And then to that point, there is more gradation in the tooth as well. So the incisal edges or the biting edges are translucent. And then the middle of the tooth, as you go up, let's say on your front tooth, is sort of the middle color. And then your gum line is usually a little bit more yellow or darker than the rest of the tooth. And that's because there's less of that hard enamel on your gum line because it kind of tapers off into a bevel. And so there's less enamel, so more of that yellowness of the inside of your tooth shows through.
Right.
So another thing to do to make veneers or composite bonding look more realistic is to gradate it. So even if we pick a really white color, I want to make it slightly darker at the gum line.
Right.
And that's going to make it fit in and like kind of flow.
Yeah, so it's not all one block of color.
Exactly.
Yeah. A lot of nuance with this white. So white in itself is not like the goal, really.
No, but understanding like how much translucency you want. If you want those natural effects that make it look realistic. And the last thing that'll do that is surface texture. So our teeth are not flat in their shape on the surface. They actually have kind of like waves in them, and that's because of how they were developed.
Right.
They get developed into lobes that then fill in. So looking at how much anatomy you want on the surface of your tooth as well to make it look realistic.
Yeah. For more information, we do offer free online consultations. You can book them yourself on our website, ladentalclinic.com.
See you next time.
Bye.
Thank you for listening to the Smile Sisters. If you found this episode helpful, subscribe and leave us a review. To book a free consultation, go to ladentalclinic.com.